So, insulin. In type 1 diabetes mellitus, the only choice is insulin. So, no other drugs or hypoglycemic agents we can't try with this type 1 diabetes mellitus, mainly because pancreatomy has been done or beta cell mass won't be there and it won't be able to produce insulin. So, replacement therapy of insulin is the only option for type 1 diabetes mellitus. This insulin regulates the blood glucose by majorly two mechanisms. One is by increasing the glucose uptake by muscle and fat. So, the glucose has to be utilized in our skeletal muscle, fat as well as adipose tissue. In this area, the insulin increases the utilization of glucose. That means entering glucose inside the cell will be stimulated by this insulin by a receptor called GLUT4, GLUT4 receptor. So, this is the receptor which allows glucose inside the cell, that is stimulated by insulin. The second process is by blocking or preventing the hepatic glucose production. Glycogenolysis is inhibited, that means production of glucose from glycogen. The glycogen is converted to glucose, that process is inhibited so that the plasma glucose level can be maintained. And the second one is blocking gluconeogenesis, production of glucose from organic compounds other than carbohydrate substances. If glucose is produced, that process is called as gluconeogenesis. So, that is also blocked. And third one is stimulating glycogenolysis, that is production of glycogen, formation of glycogen from the glucose. So, that is stimulated. So, by these process, the hepatic glucose production is inhibited by this insulin. So, insulin majorly it acts by increasing the glucose uptake and inhibiting the production in the liver. Other than that, what are the actions of this insulin? We will see. Coming to the pharmacological actions of insulin means, as I already said, this skeletal muscle as well as adipose tissue are the major two reasons where glucose metabolism takes place. Insulin in adipose tissue, it increases the glucose uptake. So, the plasma glucose will be reduced and the uptake by the adipose tissue will be increased, and increases lipogenesis, formation of lipids, and decreases the lipolysis. And in skeletal muscles, it increases the glucose uptake, glycogen synthesis. The stored form of glucose is stimulated as well as protein synthesis is also stimulated. In the liver, it prevents or blocks the production of glucose. So, gluconeogenesis, production of glucose is blocked. At the same time, glycogen synthesis, storage of glucose is stimulated and lipogenesis is also stimulated. So, finally, insulin stimulates glycogenesis, formation of glycogen, proteogenesis, formation of protein, lipogenesis, lipids, as well as anabolic reactions. So, genesis, formation of glycogen, proteogenesis as well as lipogenesis. Formation of these compounds are stimulated by insulin. At the same time, if insulin is not there or if insulin is not present or in our body, what will happen? It will lead to glycogenolysis, that means breakdown of glucose. Proteolysis, breakdown of protein. Lipolysis, breakdown of lipids, and catabolic reactions will occur. So, now we can easily understand. These are the manifestations of diabetes mellitus. The symptoms of diabetes mellitus means these are the things. The first and foremost one is hyperglycemia, increase in the blood sugar level. So, why increase in blood sugar level occurs? Insulin is not there. So, breakdown of glycogen takes place. Glucose automatically comes to the blood plasma. So, that is the main reason for hyperglycemia.